Hello, this is Mark Rothstein with my latest informational video on COVID, which focuses today on the new updated COVID vaccines and some related issues. First, I want to start with my usual disclaimer. I'm not a physician, and nothing I say should be considered medical advice. For that, you should consult with your own physicians. I'm also not an epidemiologist, virologist, or other type of scientist. My background is in public health ethics, law, and policy. I served as an advisor to the CDC on coronavirus policy. I'm the former associate editor for public health ethics and law of the American Journal of Public Health, and I've written widely on COVID. This video is being recorded on September 5th, 2024. As most of you know, the virus responsible for COVID, SARS-CoV-2, continues to mutate, which means that to protect against it, vaccines also need to change. The latest vaccines that have been developed target newly circulating strains of the virus, and they're more effective against these strains than the prior vaccines, which is, of course, the important thing. The dominant strain in the US now is KP.3.11. It is expected that the new vaccines will protect against this and related variants that emerge in the future. I think we need to get used to the idea of periodic reformulations of COVID vaccines to target new strains, just as we have updated annual flu shots. With increasing rates of COVID in many areas, there is clearly a need for people to get the updated COVID vaccine to maintain their immunity, and high-risk individuals ought to be first in line to do so. Updated versions of Pfizer's and Moderna's mRNA vaccines were recently approved by the FDA and recommended by the CDC. As before, you can get the Pfizer vaccine even if you previously received the Moderna vaccine and vice versa. Last week, the FDA also authorized the use of a new version of the Novavax vaccine for individuals 12 and older. Individuals with medical or other concerns about mRNA vaccines should consider Novavax, which is a protein-based, not RNA-based vaccine. In the past, a problem with Novavax was its limited availability, and we'll just have to see if that's still a problem today. All three vaccines are overwhelmingly safe and effective. If you've heard otherwise, and there are lots of wild rumors and reports all over the internet, I recommend that you check out the CDC website, cdc.gov, which debunks various unsubstantiated claims that COVID vaccines are harmful and should be avoided. It's also important to remember that the effectiveness of any COVID vaccine wanes over time. After 6 months, the vaccine may be only 50 to 80% effective, and the immunity from a prior COVID infection also fades over time. That's why updates, or what used to be called boosters, are essential. Unfortunately, the uptake of additional vaccinations has remained low, even in high-risk groups such as older people. The CDC recommends that everyone aged 6 months and older get the Pfizer or Moderna vaccine, and for those 12 and over, they can get Novavax. Vaccination remains critical for individuals at increased risk of severe COVID, which would include people 65 and over, those who are immunocompromised or on chemotherapy, organ transplant recipients, residents of long-term care facilities, and those who are pregnant, might become pregnant, or are breastfeeding. With regard to children, despite the CDC's recommendation of vaccination for everyone 6 months or older, only 40% of children under 12 have been vaccinated, and only 5% are up to date on their boosters. Many other countries, including the UK, France, Japan, and Australia, have decided that children do not need booster shots because they are at lower risk of severe COVID. I've thought about this issue quite a bit, and I think it makes sense for children to get boosters if they are likely to be exposed to large numbers of unvaccinated people, especially in indoor settings, where the child could become infected, or if they have contact with high-risk family members or other individuals where the child could spread the infection to highly at-risk individuals. You might want to ask your child's pediatrician for advice on that. One reason for reluctance about additional vaccination of children is their frequent fear of needles. Nasal spray COVID vaccines are being developed, and I think one of these days they may be available both for children and adults, but unfortunately not yet. As a reminder, COVID vaccines are not designed to prevent you from becoming infected, and it is not a substitute for masking when appropriate, avoiding people who are sick, avoiding crowded indoor environments with strangers, and other prevention strategies, many of which I've talked about in past videos. COVID vaccines were, in fact, designed to prevent severe disease, which can land you in the hospital, ICU, or worse. Vaccination also lowers the risk of long COVID. Worldwide, it has been estimated that vaccination against COVID has saved 20 million lives. I've received several questions, and I've selected 6 that I want to answer on this current video. So let's begin. Question 1. If you've had COVID recently, should you get the new vaccine? According to the CDC, you should wait 3 months after a bout with COVID before getting the updated vaccine. Number 2, can you get a COVID vaccine and a flu shot at the same time? The answer is yes, but the main reason for doing so is convenient. If you have time to get separate vaccinations, you might want to hold off getting the flu shot until October, because it is closer to flu season and might give you longer protection this winter. I got my updated COVID vaccine yesterday, and I will get my flu shot sometime next month. You can check with your doctor about the timing that I just mentioned, but please do not neglect to get your flu shot. Seasonal influenza kills about 30,000 people in the US every year. Influenza, despite how loosely the term is used, is not the same as a cold and should be taken very seriously, especially by people in high-risk groups, such as older people. Question 3, can you become infected from touching inanimate objects, which are known as fomites, such as on tabletops and clothing? COVID is a respiratory disease spread by inhaling respiratory droplets and airborne bits of virus. In the early days of the pandemic, when it wasn't clear what caused COVID, some people wore gloves and repeatedly wiped surfaces with Purell, Lysol, and other disinfectants. Although good hygiene, including frequent hand washing, is important in preventing other illnesses, it's unnecessary and unhelpful in preventing the spread of COVID. Question 4, are COVID vaccines safe for people who are immunocompromised? COVID vaccines, including the updated vaccines, are safe for people who are immunocompromised. In fact, because the immune response to the vaccine may be lessened in these individuals, the CDC advises that, quote, people who are moderately or severely immunocompromised may benefit from additional doses of the updated COVID-19 vaccine, end quote. So immunocompromised people should not forego the vaccine based on fears that it will worsen your condition. Again, I recommend checking with your doctor. Question number 5, how long after vaccination does a person have maximum immunity? And the answer is, in a few weeks, the vaccine should have full effectiveness, and it will last several months. And finally, question number 6, can younger people develop heart problems from COVID vaccine? There are actually 2 heart conditions that have been raised in these sorts of questions. Pericarditis is a swelling of the tissue surrounding the heart. It is mild and almost always resolves without treatment. Myocarditis is an inflammation of the heart muscle itself that can be caused by an immune response. It is usually mild and transient, but can be more serious. There have been reports of males ages 12 to 20 being diagnosed with myocarditis between doses that after a second dose of the mRNA COVID vaccine. One way of trying to prevent this effect is to lengthen the interval between the first and second or subsequent doses. It's also important to note the following three things. First, the overall risk is quite low for this response, about 12 cases per million doses. Second, the frequency of vaccine-associated myocarditis is actually lower than myocarditis caused by COVID. And third, vaccine-associated myocarditis tends to be milder than other types of myocarditis. For these reasons, public health officials overwhelmingly believe that concerns about possible myocarditis should not deter vaccination against COVID. Again, if this is a concern, you should raise it with your physician. Well, that's it for today. Thank you for watching. And for those of you who submitted questions, thank you for your questions. I hope this video has been helpful. And as always, I wish all of you good health and much happiness.